I'd like to invite Dr. Dan Geisler to the podium to speak on single incision laparoscopic proctocolectomy with ileoanal anastomosis, initial operative experience.
I'd like to thank SAGES and Dr. Tonya Young-Fadak and Dr. Fleshman for the opportunity to present our initial experience on single incision laparoscopic restorative proctocolectomy. We first developed single port right colectomy in a case that was first presented in 2008. This was for a unresectable polyp, and that was more of a feasibility type thing. Can it be done? We saw that it could be, and we decided to let's start pushing the limits, see what else we can accomplish. To me, a obvious opportunity is working through a stoma site. You know you're going to have a 2-centimeter incision. Let's use that to access the abdomen. The surgery we're talking about is removal of the entire colon and rectum and the formation of a J pouch with a temporary loop ileostomy. I personally think it'd be a crime not to mention Dr. Vic Fazio when dealing with ulcerative colitis or with J pouch surgery, a true pioneer in this surgery and someone who's done more than any. He brought me in years ago to head up the minimally invasive side of things. The way that we initially started doing laparoscopic J pouches was through a 4-port technique, and the idea is can we get rid of ports 1, 4, and 3 and operate through the number 2 port and do the same operation. What we saw with just our restorative proctocolectomy laparoscopic versus open numbers is some surprising data. Obviously they're going to recover quicker and have less pain and discomfort, but we also found some functional outcomes at 1 and 5 years' time. That included the number of daily bowel movements that was significantly less in the laparoscopic group versus the open group. Furthermore, the chance of them needing to wake up many times during the night was much less in the laparoscopic group. So some very compelling functional data. And finally, a lot of these patients obviously are young. Some social restrictions such as the use of pads, which was much less likely in the laparoscopic group. Finally, and this was presented in British Journal of Surgery last year, dietary restrictions. Obviously, none of us want to have to think that, hey, we can eat this or not and can't eat that. The laparoscopic group, much less likely to have dietary restrictions. So the idea is how much less can actually be more. What we're talking about with single port surgery is working through a single incision. At the end, I typically do put in a drain, and we don't typically use that as a port site unless a retraction port is needed. The benefit of doing it in an operation like this is it does make it a much more natural operation. We are right off the midline. You are working directly towards the pathology at all time. You can triangulate tissue and get excellent traction, usually by just grasping the tissue 3-4 centimeters away than you normally would, but it does facilitate the operation going through one central access port. So we looked at our initial numbers from June through September of 2009 and evaluated our first 5 cases. There were 3 men and 2 women. The age was 36 years with a range of 13 to 47 and a pretty low body mass index, 21, with a high of 25.9. The majority of these patients were for ulcerative colitis, and the one younger patient was for familial polyposis with numerous rectal polyps. The estimated blood loss was quite low, 50 to 200, and there were no conversions to open. Bowel function, as we expect in a minimally invasive case, did come back much quicker, as did discharge, that the majority of these patients were home by day 4. Additionally, I'm compelled to close the ileostomy, which most patients want, and we typically do that before 2 months. The surprising thing we found was OR time, and we wanted to look at how is it compared to conventional laparoscopy and how is it compared to open resective procedures. Looking at the giants at the clinic that have been doing open surgery for years, the average length of time for a J pouch is 196 minutes, so just over 3 hours. Our laparoscopic data was pretty compelling. It was a little longer, but definitely within reason. What we were surprised to find out with single incision surgery, it was actually less, not just less than laparoscopic, but less than open surgery as well. We've now done 13 restorative proctocolectomies, and we've knocked 5 more minutes off the mean time. But it's very compelling to think that maybe this single access and a central access does facilitate the operation and makes for a more efficient operation. So in conclusion, I would like to say that single incision laparoscopic restorative proctocolectomy is definitely feasible. There are definitely some short-term advantages, just like we would expect with minimally invasive surgery, and there does appear to be a very significant and compelling improved operative time. I thank you for your time.